What sort of heart condition can diphtheria cause? Severe myocarditis. How do you confirm Hirschsprung disease? Rectal suction and biopsy. True or false? Rupture of chordatididae or papillary muscle can cause acute menstrual regurgitation. That's definitely true. Does Ehlers-Danlos syndrome increase the risk of mitral valve regurgitation? Yes. The net clinical benefit of a medication is a measure of its possible benefits minus its possible harm, all right? What sort of approach reserves randomization in any sort of study? The intention to treat approach. What sort of surveillance helps with inadequate power of a study? Post-marketing surveillance. If a patient comes into your clinic and has a ureteral stone and is symptomatic, what could help them? A percutaneous nephrostomy. How effective are IUDs? Greater than 99% effective at being contraceptive agents. If a kid has a fever that does not respond to acetaminophen, what should be on the top of the differential? Kawasaki disease. How do you treat symptomatic Kawasaki disease? Immunoglobulin. What sort of imaging does a Kawasaki disease child need for their heart? Echocardiogram. So say a person with Kawasaki disease got IVIG. Can you give them live vaccines? Yes, but you gotta wait 11 months because IVIG interferes with live vaccines. So wait 11 months. True or false? You want to maintain adequate hydration when out in the sun. That's definitely true. If a calcium level is somewhat less than 12 milligrams per deciliters, but only slightly, what sort of hypercalcemia would that be? It would be a mild hypercalcemia. True or false? Verapamil can precipitate digoxin toxicity. True. Verapamil can precipitate digoxin toxicity. What is the best diagnostic test for Lyme disease? A serum enzyme-linked immunosorbent assay. Are most Lyme patients disease-free after oral antibiotic therapy? Yes, most Lyme patients are disease-free after oral antibiotic therapy. If an old person falls, what sort of workup should they get? Yeah, check their bone mineral density of the hip and spine using a dual energy X-ray absorptiometry. What does a t-score less than or equal to negative 2.5 indicate? Osteoporosis. And you need to treat that osteoporosis with what? Bisphosphonates. Yeah, bisphosphonates first. For a uterine rupture, what sort of management should they receive? An emergency laparotomy. How do you treat non-gonococcal urethritis? Starts with an A. Azithromycin. If you have a concern for non-gonococcal urethritis and it didn't show up on the first swab, what should you do? Repeat the urethral swab and a gram stain. For hepatitis B acute infection concern, what should you measure? Measure the IgM antihemoglobin C and liver enzyme levels. For parents, smoking is associated with what? With their children. Hearing is a clue. Acute otitis media, right? You don't want parents smoking near their kids because it will cause acute otitis media. If a patient has an iron deficiency and a positive fecal occult blood test, what sort of procedure should they get? A colonoscopy. Okay. 27, 28. If some person had 2 UTIs in 6 months or 3 UTIs in a year, what medication should they receive? Antibiotic prophylaxis. Can non-typable H flu cause acute otitis media? Yes, non-typable H flu can cause acute otitis media. And in general, how do you treat acute otitis media? Amoxicillin for acute otitis media, amoxiclav for repeat acute otitis media. So 3 acute otitis medias in 6 months, those individuals need a myringotomy and tubes or bad. Okay. If you have a concern for lead toxicity in a patient and they're asymptomatic and you do the lead levels and it's, fine, whatever, or something, should you repeat the lead level in about a month? Yeah, yeah. If you have a patient with dyspepsia, what procedure should you do? An endoscopy, right? If LBP, what is needed? An X-ray, spine, and ESR, right? Regarding tetanus prophylaxis, this is key, so set this in your memory. You give the tetanus toxoid vaccine if it's been over 10 years or if it's over 5 years and dirty or if they never got it. And if they never got the tetanus toxoid vaccine, you definitely give it to them. But also if it's dirty, this is the caveat, give the tetanus immune globulin. So you only give the tetanus immune globulin if it's dirty, right? Plain x-rays do not pick up stress fractures well, okay? Keep that in mind. And for stress fracture, how do you treat? Treat with reduced weight bearing and graduated exercise in approximately 12 weeks. Can you recognize allergic contact dermatitis? Yeah, it's pretty easy, and usually it's where like nickel is contacting the skin or where some sort of allergen is in contact with the skin. The common things you'll see is like with a watch or some earrings or a necklace or a belt, right? Bracelet. Okay. If a patient has increased deep tendon reflexes and muscular rigidity, what should be on the differential? Serotonin syndrome. If a patient has mucosal inflammation that leads to rupture of superficial vessels, that can cause what? Hemoptysis. A patient with vasovagal syncope needs education and routine what? Follow-up. In regards to 27, this is super critical. Palpable breast mass. What do you do if they're below 30 years old? Ultrasound with or without a mammography. And if it is a simple cyst, you just needle aspiration if the patient wants. It's if a complex cyst or mass, you do an image-guided biopsy. Now, what do you do if it's a palpable breast mass in a female that's older than 30 years old? You get a mammogram first, plus or minus the ultrasound. If you suspect malignancy, you do a core biopsy. You feel me?